The collaboration between the YWCA Clinic and Women's College is a project that began about 2.5 years ago. We provide on-site primary care to the women who live here at this building.
The YWCA Toronto's Elm Centre includes 300 units of permanent housing for women and women-led families. 165 units are affordable units. We have a significant community.
And it's an opportunity for me to get to know the women who often have difficulty reaching out to healthcare services for different reasons. And then what I do is I then connect them to ongoing primary care or provide care on site until they're ready to be seen in a regular primary care site.
A number of the women who are living at the Elm Centre traditionally have faced barriers to accessing healthcare. And so the partnership we have with Women's College Hospital allows us to have someone here who understands women's health care, understands trauma histories, mental health concerns, substance use patterns.
My role here is to work collaboratively with the team at the YWCA, and that includes case managers and their mental health support team, as well as working with the Jean Tweed Support Services, which is addictions counseling services. Being on site and having a clinic within the actual residence of these women helps to improve their care, because often the women that I see have lost trust with the healthcare system, so even leaving the building to go to a doctor's appointment was very difficult. So part of my role here is to rebuild that trust, and rebuilding trust on site is much easier to do than asking someone to come to me.
For some women with mental health concerns, just leaving their apartment is really difficult. The fact that she comes to where they live is something that's innovative, and it's really meeting people literally where they're at.
Often they're living below the poverty line and they can't access things like access to medications, access to transportation to get to a family doctor. Prior to us being on site, the women often access their care through emergency rooms and walk-in settings. And so they didn't have a comprehensive family practice support network around them. They would be lost in the system, they would go from one hospital to another, there wouldn't be a consistent provider who knows them and is able to advocate for them. Often because they haven't been accessing regular primary care, they haven't had their basic preventative care measures done, so including Pap tests and mammograms and colorectal cancer screening. We also work collaboratively with other programs in the city to try to offer increased services to women on site. So the collaboration between Women's College Hospital and the YWCA is an incredibly important initiative. It shows that we are supporting these women who have often been left out of the healthcare system for a variety of different reasons. It shows that we're actually here to support you and to help you in your goals of wellness, regardless of what your background is, what your socioeconomic status is, and what your ability is to access care. Partnerships like this really demonstrate the commitment that Women's College has to equity and providing healthcare for all.